Today's top stories in cannabis include dispensaries no longer deemed essential for some Canadians, a positive rule change announced by the DEA, and a cautionary tale with some sad news from Louisiana. It's Tuesday, April 7th, and your Trichomes Morning Buzz starts now.
Broadcasting live from the trichomes.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First today, Ontario, Canada cannabis stores are now shut down and deemed no longer essential. Cannabis Health Insider reports that many cannabis dispensaries were relieved when their businesses were deemed as essential during the nationwide lockdown due to this global pandemic. However, it was short-lived as the provincial government of Ontario has removed cannabis stores from their list of essential businesses. The cannabis stores were consequently being legally ordered to close as of Saturday night. 52 cannabis retail stores in the province were allowed to remain open and operate after being labeled as essential businesses by the provincial government of Ontario. Meanwhile, at-risk workplaces were ordered to close on March 24th in the attempt to prevent the spread of COVID-19 during the nationwide lockdown. Cannabis and liquor stores have remained open while the government order closed down many non-essential businesses in the province since March 24th. According to Ontario Premier Doug Ford, mental health and addiction experts had voiced how it was absolutely critical for these stores to remain open at the time of the initial list of opened and closed stores during the COVID-19 pandemic. A revised list of essential businesses was released by the provincial government on Friday, thus stating the end of the classification of cannabis stores as essential. The cannabis stores were further ordered by the government to close by 11:59 on Saturday. Furthermore, they shall remain closed for at least the next 14 days. Although beer and wine and liquor stores are still deemed as essential and will continue to remain open, Ontarians who want to purchase legal recreational cannabis come Sunday will have to resort to the online Ontario Cannabis Store, the only remaining licensed cannabis retailer that remains open.
Next, prescription CBD is no longer a federally controlled substance, the DEA says. According to Marijuana Moment, the DEA has removed a cannabis-based medication from the list of federally controlled substances. GW Pharmaceuticals announced on Monday that Epidiolex, a prescription drug it developed that's derived from cannabis and used in the treatment of epilepsy, has been taken off Schedule 5 of the Controlled Substance Act. Effectively, immediately, the CBD medication is no longer a controlled substance, the company said. That means individuals will be able to more easily obtain Epidiolex. GW said in its notice that it will begin the process of implementing those changes at the state level and through the Epidiolex distribution network. After that point, state reporting requirements under prescription drug monitoring programs will no longer be applicable. Like many non-controlled drugs, people will still need to get a prescription from a doctor, but those prescriptions will be valid for up to a year and can be transferred among pharmacies. The FDA approved the medication in 2018, and at the same time, the DEA said it would be placed in Schedule 5 rather than Schedule 1, like cannabis and its derivatives. The FDA pushed back in a letter to the agency, arguing that CBD carries minimal risks and has established health benefits, and so it shouldn't be controlled at all. The DEA explained that international treaty obligations warrants its control, albeit in the least restrictive category of Schedule 5. The FDA then said that if that changed, the agency should promptly revisit its status as a controlled substance. Meanwhile, the FDA is in the process of developing regulations for hemp-derived cannabidiol products that aren't approved as medications following the 2018 Farm Bill's legalization of the crop and its derivatives. The agency said in a report to Congress last month that the rulemaking process is ongoing, but it's actively exploring pathways to allow for lawful sales of the cannabis compound as a dietary supplement, and is developing enforcement discretion guidance for products that are currently on the market.
Next, some sad news that a nonviolent drug offender is the first prisoner killed by COVID-19. According to Ganjapreneur, Patrick Jones, a 49-year-old inmate in a low-security penitentiary in Oakdale, Louisiana, was serving his 13th year of a 27-year prison sentence when he contracted COVID-19 and subsequently passed away. Jones was sentenced in 2009 on drug charges after police found 9 grams of crack and 21 grams of cocaine in his Temple, Texas home. He spent the last 12 years contesting a sentence that ultimately killed him. Ironically, it seems it is his death that might finally bring his case some attention, said Allison Luman, a New York lawyer who had represented Jones. His request was denied on February 22nd, and he passed away 22 days later. Jones was the first prisoner coronavirus casualty in the U.S., but there have been and there will be others. The Oakdale prison where he was located has been the hardest hit in the country. At least 5 inmates there have perished from the disease, and there are so many prisoners suffering symptoms of the virus that officials have stopped testing presumed cases. On Friday, U.S. Attorney General William Barr ordered the expansion of early release practices for federal prisoners in response to the virus' rapid spread through the U.S. prison system. You can learn more about how to help people like Patrick Jones by visiting lastprisonerproject.org.
Now is today's Morning Buzz. Come see what industry professionals are saying and join the conversation with the cannabis community at trichomes.com.
And be sure to keep up with us on all social media platforms, subscribe to our podcast, and the Trichomes YouTube channel for daily content. My name is Allison Ben-Yehuda.
And my name is David Fortin. Stay safe out there.